Welcome back to the Beyond the Bestseller podcast. I'm your host, Kelly Schuknecht. Today's guest is Lauren Tetenbaum, author of Millennial Menopause. Lauren, I'm excited to have this conversation. Not excited to be in this menopause phase of life, but excited to have this conversation with you because I am in that phase of life. So welcome, Lauren, and I'd love to have you start out by just telling us about why you wrote this book.
Thank you so much for having me, Kelly. I am a mom of two. I'm a millennial, very proud millennial. I am a psychotherapist. I live in New York, and I've always been an advocate for women and women's health. And I wrote this book because I realized that all I knew, despite my education, training, interest in women's health, all I knew about menopause was what you just said, which is that women don't really look forward to it, and of course that it's the end of one's period and one's fertility. But I realized I knew nothing beyond that, and I wanted to find out more.
Nice. So I will say, I'm not like, whatever. I'm not like against this phase of life. It's just more of like, so honestly, 2 or 3 years ago, I was at the doctor for my just annual appointment, and she asked me if I was having, I think it was what do you call it? Like the night sweats or whatever, and hot flash. Like, are you having hot flashes? And I remember just being like, how old do you think I am? Like, yeah. I honestly asked the doctor that, and at the time I would have been like maybe 44, 45, right? And then I was like, oh, that is like the time when that happens. But I remember, and so part of why I have this like feeling about menopause is just like, I remember my mom going through the hot flashes, right? And I was like I'm not that old, right? But like, but I am probably at the age that I remember her being when she was going through that, But so at that time, I remember thinking like, nobody's ever really talked to me about any of this stuff. Like when you're like in your preteen years, everyone wants to talk to you about starting your period and starting, like I remember that and just being like, I hated all that stuff. I didn't want to talk about it. I didn't, but as I hit my 40s and got mid 40s, like I don't really remember anything. Other than my mom taking off her sweatshirt and complaining about, or taking off her cardigan, whatever, and talking about like having hot flashes. Like I remember that, but like that's the only thing. So then I felt like I felt very unprepared for this. Now I feel like because I'm in tune to it, like I'm seeing videos and books and like all of these things that are like, now it's like very much in my awareness, but it wasn't 2 or 3 years ago. So anyway, all of that to say, I'd love to hear from you kind of what you learned about, because I've actually been surprised, like the time period of perimenopause is a lot earlier than I thought, and a lot earlier for people than like I started seeing signs of that in my life. But so tell me about kind of what you learned about menopause and just kind of when that phase starts happening. Because we actually started, before we started recording, I mentioned to you how young you are. And so, writing this book was kind of your researching going into this phase. So talk to me about that.
So I'm 40, and millennials are born between 1981 and 1996. And of course, our older sisters and friends who are in their mid-40s are already in perimenopause, because perimenopause is the phase of time leading up to menopause, which is really one day marked by a year of no periods absent any other health reason. And perimenopause is characterized by hormonal fluctuations that lead to a wide variety of physical and emotional symptoms. And that phase can last between 4 and 10 years or more. Not every woman experiences all the symptoms, any of the symptoms. Every woman's experience is different. But what I was really struck by was the timing, like you mentioned. I didn't know until I started learning that perimenopause can and often does start in one's late 30s, early 40s. I didn't know about all of the symptoms that can be part of the menopause transition, and I didn't know how to treat it. And that is really what I wanted to share with my peers, my clients, my friends, myself. And now I feel very equipped because, like you said, we have health class, we have conversations about sex and puberty and pregnancy, and we could have more, to be sure. But preparation and knowledge is so powerful, and I really wanted that for this phase of life.
Mm-hmm. Mm-hmm. So what are some of those symptoms? Because I do think I see people now, like I said, it's in my awareness now. So like I'm seeing TikTok videos, I'm seeing Instagram videos and things, but people will talk about perimenopause symptoms that sometimes I'm like, what? Like that is like for example, itchy ears.
Yeah.
That is a symptom of perimenopause that seems, I feel guilty saying this to a therapist, but seems a little crazy, right? But like, but I can tell you, I have that at night. Like I will wake up at night and I'm just like, like my ears, like I have to like turn my head and I'm like, why? Why is that a thing? But what are some of those symptoms that people experience that they may or may not even realize are perimenopause symptoms?
Totally. So itchy ears, ringing in the ears, frozen shoulder, joint pain, itchy skin, itchy other parts of your body that you never would have expected have estrogen receptors, but they do. Changes in voice, changes in allergies or histamines, night sweats and hot flashes, you mentioned, irritability, rage, symptoms of anxiety and depression beyond what I just mentioned. Brain fog and ADHD symptoms can get exacerbated, forgetfulness, difficulty concentrating, midsection weight gain, and a wide variety. Again, not every woman experiences all of these symptoms or any of them, but it was really eye-opening for me to learn about the mental health implications, which as a mental health professional, I was shocked that I had no idea. And when I looked back on conversations I've had with women who said to me, in whatever capacity, personal or professional, that they had gone to several doctors trying to figure out what was going on with them, and it was vertigo, but it wasn't getting diagnosed, and and they were having these issues, and now I'm thinking it must have been perimenopause. And so I feel really like powerful that we can help women know and have agency over what they want to do about treating those symptoms.
Mm-hmm. So you mentioned that menopause is really when you have stopped having your period for a year, right? And so that's kind of, I think I don't know if there's confusion but people just kind of use, I think, menopause as a term for this phase, even though it's actually, you're not actually in menopause yet. Right. But anyway, so just wanted to clarify that. But so some of those symptoms that you just mentioned, do those go away once you hit that once that 1 year period menopause actually happens?
So yes, there's a lot of good news that once menopause happens, which then you're postmenopausal forever, often the symptoms subside, especially the hot flashes, the brain fog, the mood issues. And it's not immediately, it's not like, a birthday party and then you're done forevermore with those symptoms. But within a few years of that time, they do tend to subside. On the other hand, there are additional health issues that we have to take into consideration once we reach menopause, because by definition, women's estrogen and progesterone levels have declined, and we're no longer producing estrogen through our ovaries. And that can have implications on our cardiovascular health, our brain health, our bone health. And so that's why hormone therapy is actually quite safe and effective and can help with preventing osteoporosis, dementia, heart disease, etc.
So talk to me about that. I've heard of some of my friends who have done some hormone therapy, but I've heard
the difference.
So yes, explain the difference. But then also, I went to a doctor just saying like, hey, some of my friends are doing this. Like, is this something I should be doing? She asked me a series of questions and was like, you don't really need that until later. Mm-hmm. And so, which is fine, but then I'm also like, should we listen to our doctor? Like I've been listening to some podcasts about perimenopause and menopause and this phase of life, and some of the doctors that I've heard talk about it, really talk about how untrained our doctors are on this, like how little they really know and understand about it because of the lack of studies, and then hormone replacement, or HRT, like had some bad kind of publicity in the past. So then, so anyway, so talk about some of that, and just what women should know about, and I know you're not a medical you can explain the difference there, but
yes.
But if you can kind of explain some of that and what people should know, and what they should ask their doctors, so that they are, going into those conversations a little more prepared.
Absolutely. So I will start with definitions. So hormone therapy is what we generally refer to when we're talking about medical treatment of menopause symptoms. And we're typically talking about progesterone and estrogen, or synthetic versions of those. Sometimes testosterone falls within the hormone therapy treatment, but we typically talk about that kind of separately. Testosterone is a female hormone, just to be clear. Hormone replacement therapy is sort of the older terminology that was used, or HRT, and it's not really an accurate description for hormone therapy in a woman who undergoes menopause at the average age of 51, 52. So when someone does endure early menopause because it's induced by surgery or whatever reason, because she has a health condition, that is when it's more of a hormone replacement because of the levels. But in general, the term menopausal hormone therapy is more accurate and more encompassing. So I stick with that. And I explain all this in the book, and there's a glossary and everything, because I too was super confused and didn't know the basic definitions. And frankly, very few of us do. Related to that, many of the doctors that I interviewed, who are brilliant in their fields, they told me that they didn't know much about menopause either, and they were not provided with training. And then I did additional research and found that to be true of most American healthcare providers. A large part of the reason why they weren't trained does go back to that 2002 study that you alluded to, because the data from that study was misinterpreted and basically presented as estrogen causes breast cancer and hormone therapy causes breast cancer. That conclusion has been effectively debunked. All medication comes with risks. All medication should be discussed in a thorough conversation with your individual healthcare provider, which I'll get to. But that being said, in general, hormone therapy is considered the gold standard for menopause symptoms. And unless you have a very specific active contraindication, which again I go into in the book, and I give referrals to doctors and ways to find doctors, unless you have a contraindication, it might be worth trying. Now let's get to your scenario and how to trust your doctor. So in general, I would say if your symptoms are bothering you, it's worth doing something about it. Now, are you, and maybe not you, Kelly, but for the, the listener, are you stressed because you're having hormonal fluctuations, or because you have a lot going on at home and it's stressful? Maybe either, maybe both, but it's worth pursuing treatment, whether that's through psychotherapy, medication like anti-anxiety medication, or medication like hormone therapy. If your doctor is not willing to engage in this conversation and is dismissive outright, I would say, let's find a new doctor. If your doctor seems unsure, I would say you can go to the Menopause Society. It's menopause.org. You can look for a provider there, but also if you trust your doctor and maybe just don't know if they don't know, you can print out very clear guidelines, their latest guidelines, and bring it to your doctor and say, I'm not sure if you are aware of this. I came across this. What do you think? Because all good medical care should be collaborative and should give the patient autonomy and the decision-making ability.
Yeah, that's really helpful. Those resources are really great. I did tell my doctor, I was like, I don't know if I'm ve- like, I feel like self-awareness is a part of it that I'm not. It's like when you ask me, like, whatever those questions were, I remember being like, like anxiety is one of the things that women start to experience more of, right? Well, in the
Low
last year I lost
libido,
my
fatigue.
yeah, but like I started, I lost my job, started a business, like, so those things I'm like, well, is it anxiety because of my phase of life or because of what's going on in my life, right? Like, so it's like things like that. Or, like night sweats. I'm like, well, I remember waking up a few times hot, but I think that just my room was hot. Like, I don't think it was, so she was like, okay, I don't really think you're having these symptoms so much. But then I hear from other people these symptoms they're having, and I'm like, I should be, right? Like, but like you said, we're all different, and it's I don't know. It's like hard to. I think that's what makes it so complicated. Is it's like it's hard to know, is it because of this or is it something else? And for me, I think it hasn't disrupted my life enough to like be a problem so much. But the hormone treatments, like one of the things she talked about was the pellets. And I'm wondering if you know enough about that to kind of talk about that a little bit, because she didn't recommend it, and I don't know what your feelings are. So I don't have a feeling. I just know she didn't recommend it for people, just even in general. But I know that I've had friends say that like doing the pellet treatment or the pellet, what do you call it, like injections or whatever, changed their life. So, like what did you learn about that part of it?
Sure. So again, disclaimer, I'm not a medical doctor
Yes.
or nurse practitioner, but I certainly spoke to many of them who I respect, and they really are experts in this. And I would say that the general rule of thumb from those experts is that pellets are not the standardized form of care. Instead, we can use an estrogen patch. And if you use estrogen and you still have a uterus, you need some sort of progesterone or synthetic version to protect the uterine lining. So progesterone, the kind of gold standard there is micronized oral progesterone in a pill. Estrogen also comes in a gel, in a pill, in the birth control pill. In various forms, and testosterone too comes in a gel form. Pellets from the experts that I spoke with are generally not advised, and we often see them being used at med spas, and I appreciate that people want to help. I assume the best of everyone. I really do. So it's not that I think they're nefarious, providers trying to inject women with pellets. But I think it's best to go to a licensed medical provider who is really up to date on all of the treatment options.
Sure. One of the things I think she had said about that was that once you inject them in your body, they're in your body. And so if you have too much of something or whatever, it's
you can't regulate
it's too
it.
late.
Yeah.
Like it's, yeah. So, yeah. And I wasn't pushing for it. I just had a friend who said like that was, it made a huge difference for her. So I was like, I wanted to learn about it. And then, the doctor had said to me somewhat like the hormone replacement therapy, it's more for like later, not at this stage, like.
So that's a bit of a red flag actually for
Oh,
me.
okay. Talk about that.
That is sort of the old way of thinking, that
okay.
if you still get a period, or some women don't get a period if they're on any kind of birth control that doesn't let them bleed, or if they no longer have a uterus or for whatever reason. But some doctors, some providers used to say, or the rule of thumb was, if you're still premenopausal, you don't need hormone therapy. Now the standard is when you're experiencing perimenopausal symptoms, you may be eligible for hormone therapy, and you deserve a conversation around it.
Sure. I will say, so just to add to what I said about her saying that some of that was for later, was because I wasn't having, major symptoms, or like because anything I was experiencing was pretty minor. She was just like, probably not going to help you much at this point. But anyway, yeah, I have listened to enough. Mary Claire Haver is a specialist in this, and I've listened to some of her podcasts, and I have not read her. She has a menopause book. I have not read that. I've read her Galveston diet book. But anyway, like just kind of absorbing all this information and learning like where I should be asking questions and what I should be pushing back on. And I think that anyone who is, I think even like, what do they say? Like as early as like maybe 35 plus, like if you're experiencing things like you might be in perimenopause, and that it's worth researching, reading what's out there. Yeah. Having those conversations and just learning more about it. I was actually surprised. There was a gal I used to work with who was quite a bit younger than me, like maybe late 30s, who was talking about how she would have night sweats like every night. She'd wake up with it. And I was like, what? But like your bodies are just different. And so if you're experiencing things like that, like your book is a great resource. And there's lots of, podcasts and things out there as well. So I want to talk just a little bit about the mental health side of things. So all of these, we focused a little bit on some of the physical effects, but what about when it comes to your mental health and how all of this impacts you? I mean, we talked about anxiety and stress, but what are the other ways that this can impact people's mental health?
Sure. So if you're experiencing physical symptoms that are bothersome and that are disrupting your sleep, your mental health is automatically not going to be in an ideal place. And so that's one thing. But in addition to that, menopause, the transition and the fluctuating hormones can bring about risks of depression and anxiety. You are at higher risk if you've had an episode of depression and anxiety in the past, particularly after a reproductive event like puberty or a pregnancy and postpartum period, but anyone is at risk. And I think here, knowledge is power, because that doesn't mean you're doomed to be depressed, but it means let's look out for it. And depression and anxiety can present in ways that are maybe not expected. People think of depression, they think of crying, not getting out of bed, and those are certainly signs, but rage is another one, and we see that a lot in women who are in the menopause transition. And anxiety, waking up in the middle of the night, whether it's because of a night sweat or otherwise, and then not being able to go back to sleep because your mind is racing and you're super anxious and you can't pinpoint why, that can be another reflection. And it's so important to be aware of what your baseline is, because anxiety and sadness are natural human emotions, right? As a therapist, my job is not to get rid of them, but to help women not be consumed by them. And we can do that through cognitive behavioral therapy and medication, like we mentioned, including hormone therapy, which some women, when they start hormone therapy, their mental health symptoms are alleviated without any other interventions. Not all women, but some.
Yeah. Wow. Now, how do you use the book? Do you use the book in your practice? Is it something you share with women who are in this phase of life, or how do you use it with your clients?
So it's been really amazing and eye-opening is truly the best way to describe it, because like I said, a couple of years ago, I wouldn't have seen what they were describing to me as part of perimenopause because I didn't know. And now I'm certified in perinatal mental health, and until I got into this subject, most of my clients were in their 20s and 30s, but as I age, so do they. And I'm seeing them come to me with symptoms like new issues of irritability and feeling like they get consumed by, one woman called it an anger demon, and not being able to control themselves or fall back on coping mechanisms that we've worked hard to implement. And it's unusual for them, and they don't know what's going on, and they feel out of control. And then again, the low libido, the cognitive functioning issues, that exacerbates everything, right? And when I suggest to them that I think it could be perimenopause, just providing that psychoeducation is incredibly powerful. And then providing them with referrals to medical providers who can give medication is also really powerful. But honestly, just the information goes such a long way.
Yeah. Yeah. Okay, I have to tell you about one of my weird symptoms that I swear is a perimenopause symptom. I want your opinion. um, over the last, I don't know, like maybe a month or two, I've noticed that this is like such a funny thing for me to be sharing on a podcast, but I will be like laying in bed, and if my husband's feet come anywhere near my legs and touch my legs, I get so much anxiety over the thought that his foot is going to touch my leg. And I've never experienced that in my life until like the last couple of months. And I had to tell him, like, please don't, like, please do not touch me with your feet. And like, he's like, okay, like, like he just goes to stretch out or something, and his like toe hits my calf or something. And I'm just like, it like lights me up where, it's not rage, but it's like, it's something like that where I am like, oh my gosh, and I honestly, he hasn't even done it like since I told him, but just him being in the bed like makes me worry that that's going to happen. This has to be a perimenopause symptom, right? Like it is out of the blue.
Well, that's what is the trigger word for me, which is it's new, right? Because you know yourself best. And if something like this never bothered you, I would say this sort of sensory issue could be perimenopause related. I don't want to blame everything on hormones fluctuating, but I think it's worth taking note of, right? And if it does bother you enough to try medication, then I think that's great. The other thing I want to say, and I'm not, pushing you to try hormone therapy, but I will just say that if you wanted to try it, you can try it. You're not committing your life to it. So,
right.
Maybe it could alleviate some of the things that you mentioned, and you don't need to reach a threshold of suffering in order to try it.
So are you saying though that like the hormone treatment would possibly help with that issue?
It could, because it just regulates all of the hormones in your body, and then you're just feeling more even keeled, and perhaps your sensory receptors are also more regulated.
I never thought about that it's like a sensory thing yeah. Okay. Well, that's really interesting. That's one that I should tell my doctor, because
let's add that to the list. Another one that I hear, because I've been doing a book tour and going to a lot of events, is women say, and I love it, women say, is your husband's chewing irritating you? Symptom?
Oh yeah. No, I have had that forever though. That is not a new thing for me. That is what do they call that?
Misophonia.
Yes.
Yeah.
Yes.
I feel like we heard that a lot
or something.
Lockdown because of COVID, because everyone was spending time with their partners, and it was like, oh my God, you chew that way?
Oh yeah. No, my kids know if they have food in the car. Now my kids are all driving now, so they're not in my car as much, but when they used to be all in my car, if anyone was like eating a Cliff Bar or something, like it just made me so irritated. And like, I would be like, stop eating, and yeah. So my husband, he doesn't bother me as much, but the kids did. And they know it. And when I first learned about that, I think it's misophonia, right? Yeah. I don't know how to say it exactly, but when I first heard about that, I was like, that is what I have, like 100%. So that is not new for me. That is like, that's just you. I have always had that, I think. But I know exactly what that feeling, it does. It makes you want to like hit somebody. You're just like, oh my gosh, I cannot stand the sound of somebody chewing or drinking or making any noise with their mouth. Like if they're, oh yes. Anyways, yes.
So to your listeners, you are not alone, and maybe it's menopause, maybe it's not, but we got your back.
Yeah. No, if I could take something to like make that go away, that would be great. But I think I just have, whatever that is. But I actually got these like ear plug things that are supposed to help with that, and I don't think they help. But really just my solution to it is like, don't eat anything around me. Other than if we're sitting at the dinner table, like eating, that's fine. But like, do not eat in my car. I can't handle it.
Good. That works for you.
All right. Well, Lauren, this has been a great conversation. It sounds like your book is really a helpful resource, not just in the feeling heard and, feeling like whatever, there's other, like you're not alone, right? But also in the resources you provide to help find a doctor, to help, those things that
men talk to people in the workplace, put menopause in the media. There are so many angles that we cover here.
Yeah, love it. So we will link to your book in the show notes. I have to just shout out for people who are not watching the video, who are just listening. I love the cover of your book because my favorite color and one of my brand colors is pink. In fact, I've got my pink water bottle here. So yes, your book stands out to me just for that. I love the brand colors there. But yeah, we will link to the book in the show notes. What other ways can listeners or viewers find out more about you online and connect with you?
Sure. So if you go to millennialmenopause.com, it will take you to my website with the book info, book tour info. I was telling Kelly that I will be in Colorado in October, and whoever is local to wherever I'm going, because I'm going all over the US, please come and say hello. And you can follow me on Instagram as the counselor, but LAUR for Lauren.
Nice. Well, thank you so much, Lauren, for writing the book and for helping women at this phase of life and for coming on and sharing that with us.
Looking for a community of women writers to support and inspire you on your journey? Join the Author Power Circle. Connect weekly with fellow authors, stay accountable, and move your book forward in an encouraging community. Learn more at kellyschuknecht.com.